Hi, my name is Ann Hosey, and I'm a licensed professional counselor in Colorado. As a licensed counselor, I work one-on-one with adults who want to maintain or improve their mental health. And in case you didn't guess by my last name, I am related to Reverend David Finnegan Hosey. He's my little brother. And David asked me to speak for a few moments today about reasons people give for thinking they don't need therapy or for not wanting to go to therapy. Therapy is a very generic term for any kind of mental health support. So you might hear words like psychotherapy, psychoanalysis, mental health counseling. Those are all words that essentially mean the same thing. They mean working with a trained mental health professional. We'll go on now to the reasons that people are hesitant to seek therapy and some food for thought for each one. So I'll start with the first one, which is a common one I often hear. My problems aren't as bad as other people's. People are suffering worse than I am. People have it so much worse than I do, like some flavor of that reasoning. Now, there is so much suffering in the world, so it makes sense that sometimes when we look at our own problems, they seem small. And the way I like to think about this is in terms of a wound or an injury. So there are the wounds of the world, that global scale stuff, and then there are individual wounds. And an individual wound, when left untended, can really get a lot worse. It can fester, it can have some unintended side effects. And if you're the type of person who has these thoughts about the suffering of the world, you probably care a whole lot, and you probably really want to show up and be able to be the type of person you want to be in the world. So if you have this untended to wound, it's going to be hard. You're going to be probably not feeling so great. And so it's going to be hard to show up and give and take care of people in the way you want to. This is that whole oxygen mask analogy, of putting your oxygen mask on first before you help someone else with theirs. So that's what I think about when I think about therapy, is it's a way to have someone who can help you tend to those individual wounds so you can be the type of person you want to be. I also find that people who say this have actually had some really awful things happen to them, and they just don't realize how big that wound is or how bad it's gotten. So that's where that unbiased, non-judgmental, caring, third-party perspective from a therapist can help to tend to that wound or that injury. Reason number 2 that I hear, I don't have a mental illness, or I'm not crazy. However, I would say all humans have mental health, and that's made up of our emotions and our thought patterns and our past experiences. We all have that. We're all walking around all day with our mental health on board. So saying that I'm not going to go to therapy because I don't have a mental illness or I'm not crazy is sort of like me saying I'm not going to go to the dentist because I don't have cavities, or I'm not going to go to the dentist because my front tooth hasn't fallen out yet. So in the same way that we do maintenance stuff with our physical health, like dentist appointments, doctor's appointments, walking, stretching, we need that same kind of consistent care to maintain our mental health. Reason number 3 that I often hear is, why would I tell my problems to a stranger? And it can be challenging at first. I think it can be legitimately scary, and people are pretty nervous when they walk into my office for the first time and are meeting me, and I'm a stranger to them, and they're having to talk about themselves in a different way. The reason it's valuable to have someone who at first is a stranger, but is trained to be unbiased and non-judgmental and to point out patterns is that we all have blind spots. Just in the same way our cars have blind spots, we all have these spots inside of ourselves that are really hard to see without an outside perspective. And while you may be able to get that outside perspective from friends and family also have their own judgments, their own biases, their own kind of shoulds, like you should do things this way. And they might not be able to support you in the same way that someone who's trained to listen to your problems and support you in coming up with solutions would be able to do. So those are the 3 reasons that I'll speak to today, and I just hope that was some helpful food for thought to consider and just something to kind of digest and chew on if you or someone you care about is considering mental health support.